Hey, this is Carrie from Wrap Your Head Around Silks. This is the Expecting Aerials podcast, now with the Digitant Network. Thanks so much for joining me and tuning in. If you haven't yet, please check out the Artist Entrepreneur podcast. I co-host it with Noah Dock and Amanda Ritchie. Join us as we navigate our artistic businesses. And just announced, I'll be at NECA, the New England Center for Circus Arts, January the 2nd through the 4th. So it's a silk immersion, 11 hours of silks on their 30 foot plus ceilings. If you want to start the year off with some serious training, let's get your mittens and your coat and let's go to Vermont and train. All right. If you guys are interested, my comprehensive online course for beginner to intermediate silks, anywhere you are in the world, check that out. And then Aerial Rehab is an online course. If you are coming back from pregnancy, injury, or surgery, it is meant to be the bridge between PT and your favorite aerial class. I'm teaching all over the place this fall, and check it out, and let's get started. My brain fog is getting real bad, okay?
Mine too, it's okay.
Now, I just interviewed this woman. Her name's Jenny Arrett. She's on this she's on our podcast, and she's going through breast cancer and all the treatment.
Oh my God.
I know. And she says to me, women out there, HRT doesn't cause cancer, but if you have cancer and you don't know about it, it will feed it. Is this a true statement?
Depending, right?
Okay.
So, I think what she meant, I definitely don't mean to speak for her, but generically, let's just say, so there's different types of breast cancers. Some of them are
hormone receptor. Right.
Right. So if you have a breast cancer that does not have a hormone receptor to hormone replacement therapy, then no, you're not feeding anything. If you have a breast cancer that has a bunch of estrogen receptors on it and you give your body estrogen, then yes. So it just depends on the type of cancer that you have. While it didn't cause it, if you did have receptors that are fed by something and you gave it that, then technically, then yes.
Maybe this is not in your wheelhouse, but all the cancers, any cancer, all the cancers, are there versions of them that are hormone receptor?
Not all cancers.
Not all
no.
cancers.
Some of them are completely spontaneous. There's uterine cancer, for example, is not hormone mediated, but it is hormone mediated because if you have morbid obesity, for example, extra adipose tissue in your body makes estrogen, and estrogen for someone who is 60 should be low. So if your BMI is 50 and you're 60 years old, you're making high amounts of estrogen in your body out in your other tissue, right? So then that's like sprinkling fertilizer to the lining of your uterus because your uterus responds to estrogen. So you can get cancer in your uterus because you've made estrogen out in your fat tissue. Does that make sense?
Yeah.
So where it is that you're getting those hormones from can affect different things. Cervical cancer, non-associated. That doesn't have anything to do with hormones. That's virus mediated. That's from human papillomavirus. So that's not associated. Ovarian cancer is most of the time a spontaneous thing that happens, not because you had extra estrogen out in your system. That can happen more spontaneously. So it just would depend on the cancer.
Okay. So my brain fog sucks. And it has been recent that has become changed for me. Like I feel like it kind of came on all of a sudden and it's at a different level now. I am not having hot flashes to a degree where it's interrupting my sleep. Really, the brain fog is probably the most pronounced symptom that I'm having. Do you give HRT advice to your patients?
I do, but a lot of my patients are seeing like a functional medicine physician, like or a provider who they want to have like a lot of testing that doesn't follow ACOG standard guideline, which ACOG is the American College of Obstetrics and Gynecology. That's how I was trained. So people who want to operate outside of those standards or be able to experience or participate in a different modality of treatment for that would see a functional medicine doctor, because there's very specific, and we're doing a tons of research, but there's very specific reasons why we can give per our guidelines to keep us within the guidelines. So we're not doing something against our guidelines. There's certain things that we can give medication for and certain things that we can't. But particularly when somebody's in premenopause versus postmenopause, those are completely different spaces. Because if you are still having periods, the amount of hormone level that you need or that you are experiencing is completely different than somebody who's not having periods anymore. When you're not having periods anymore, your estrogen and progesterone requirements or productions are way lower than somebody who is having periods, right? Because you're having periods. So you have a higher level of estrogen and progesterone. So a lot of people don't like to hear it, but the amount of estrogen that's in a birth control pill is way higher than somebody's hormone replacement therapy. So if you're a premenopausal and you want little tiny doses of postmenopausal estrogen, that may not correct you as well as you doing something higher dose like a birth control pill because you need a higher dose of those things for yourself. So the conversation about how it is that we supplement somebody who's struggling with having variation in the way that their body is producing and supplying to them estrogen takes a whole lot of different things into account. And that's a really, really, really long conversation. And we definitely want to support people because it is horrifically devastating to not know what you're doing on a daily basis. Like walk upstairs, I have no idea why I came up here. I know I was supposed to get something up here. Or joint pain. I mean, the joint pain associated with perimenopause is so horrific for people. Like you can't get sleep. Or they'll have a hot flash intermittently that's terrible at nighttime, but then they go to their meetings and they're crabby and irritated, and then somebody says something smart, because you can't be your best self. You're not your best self. And so it's hard when we don't feel like ourselves. You know what I mean? And so that's a really long conversation that I have with people to talk about risks. What are our goals? What is my expectation for my body going through this transition? What am I willing to tolerate? What I'm not willing to tolerate? What are the recommendations? And what are the things that I'm supposed to quote unquote just deal with versus I want to feel like my best self, So to be honest, I have some people who want to suffer through the most horrific hot flashes. They never want anything. And I have 70-year-olds that I'm still giving hormone replacement therapy to. And I'm happy to do it. We just had to have a long conversation about goals. What am I looking for? What testing are you going to get on a regular basis? I will not give it to a person who refuses to get mammograms. I'm not going to give you estrogen if you won't go get a mammogram. And so I hold it. You get a year's worth, you get your mammogram, and then I'll continue, after we have our conversation. And some people don't like that about me, but I'm pretty strict for the reasons that we just talked about. If you have an undiagnosed cancer, breast cancer, then I can't give that to you. It's contraindicated. If you had a stroke, if you have a change in your cardiovascular system or your situation in the past year, I need to know that. So some people are like, why do I have to come in here all the time? Because I need to document that it's still safe, for me to give that to you. So a lot of people who are looking for something more outside of traditional medicine would see a functional medicine doctor. But I would say that we are definitely want to follow Menopausal Society guidelines, which say we may be able to be giving, low doses of estrogen to help symptomology for patients, just depending. That comes with a really honest and deep conversation,
Okay, I don't know if this is the way to ask this question. What's your risk tolerance for this? Like, take me, for example. Let's just say I was lucky enough to be your patient. I'm so sour about this. I'm so salty. I'm so salty that usually you move to the big cities and you find a better doctor, but not in this case. Not in this case.
Thank you.
So let's just say it was me. And I walked into your thing and I'm like, this brain fog is making it hard for me to function in a way that I want to function.
For sure. You're still having periods, or you have the Mirena? I forget.
I have the IUD.
Okay.
Not the copper, the other one. Whenever I think copper, I think what did you call it? Like the Amazon? What did you call it? It made me laugh so hard. Like you're like,
I don't know.
You called it the Amazon or something. Anyways,
I don't know what I called it.
The rainforest.
I don't know what I did. Girl.
So I'm definitely in perimenopause, but I'm still on IUD, and the brain fog is my biggest symptom. I'm not having maybe all the other symptoms I've heard about. Now, what would you say?
Sure. I would probably say, which I say to everybody, we don't need to be getting 7 billion labs on you, because that's one thing that I do have an issue. I'll just say out loud. I do have an issue with functional medicine spaces that make people pay $300 every 2 weeks for some saliva testing, so that they can try to, based on the labs, adjust their medications. Because if you come in and tell me that you're having brain fog and your periods are kind of spacing out and lighter or whatever, then you're in perimenopause. I don't need to make you pay me $1 million to tell you that. So I do have issue with that. Also, when we treat people to lab value, it doesn't always, even if I made you physiologically on paper look like a 14-year-old, doesn't mean you're going to feel any better. So we, in ACOG says we should look at them based on symptoms. So you would come to me and say, hey, here's my symptoms. I would talk to you. What age was it that your mom went through menopause? Do you have any sisters, anybody going through menopause? Are there any other things happening for you that could contribute to this? Have you changed your diet? Are you on supplements? Are you having stress within your relationships that can disrupt our estrogen? Are you having stress because I moved? Are you getting enough sleep? Are you not getting enough sleep? Have you tried, what other supplements have you tried? Blah, 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 all these different things. So if you said, whatever it is you say, I also have to check a cardiovascular risk on a person who is postmenopausal, which means to say we type in this little calculator that tells me your 10-year risk for having something bad happen to you. You wouldn't. It takes into account whether you're diabetic, whether you have high blood pressure, what's your height and weight, your BMI, do you smoke, all these different things. You don't need to do that because you're premenopausal. So I would say, hey, you probably would benefit from having a little bit more regulated estrogen and progesterone. Do you want to try a birth control pill that gives you the same amount of estrogen and progesterone every single day, instead of having me give you little low doses of just estrogen? Because if I gave you little low doses of just estrogen, it may not be enough. Especially in perimenopause, it's not all the time that you are not producing your appropriate premenopausal dose of estrogen. If you were let's say you need 100, we're going to make numbers up. Let's say when you're premenopausal, you are producing 100. When you're postmenopausal, you're producing 10. These are not real numbers. I'm making this up. Some months you're at 100, 100, 100, 100. Then all of a sudden you drop down to 50. And then 50 the next month, and then the next month 100, 100, and then 30 the next month, and then 20, and then 100, 100, and then 20. Like, it's all over the place. So if you were at 100, and I give you 10, that's 110 1 month. If you were at 50 and I give you 10, which is the postmenopausal dose, you're only at 60. You didn't even get back to where you really wanted to be, right? If you're at 80 that month and I give you 10, you're only at 90. Like, you're chasing it around with this little dose of postmenopausal estrogen. So a lot of my patients don't get consistent results from that because they don't get enough estrogen. Like when we try to do it in little pieces. So for somebody who's still cycling, I would just say, let's just shut off your hypothalamus and let me just give you the normal amount that you would be making if you were not perimenopausal every day. So I would say that way you're steady every single day. You know what you're getting. And I'd give you the premenopausal dose of estrogen. And typically it's easiest to work with that in a birth control pill form for somebody who's premenopausal.
Okay, so my sister, who's now 50 years old, she has been on birth control as her birth control all this time, years. Sure. And so when she went to her annual, her doctor was like, oh, like she asked her about perimenopause and what are you feeling? She's like, I'm not feeling anything.
That's right, because she is on her birth.
Okay, so I'm like, this is genius. She just skipped all this crap that I'm going through, but I already have the IUD in me.
Doesn't matter. Those work in different ways. Your IUD, remember we talked about, is not sending hormone through your whole body. IUD is just telling your lining to not grow. So it doesn't have anything to do with your ovaries or your hormonal status. So your sister, for example, at 50, feeling amazing, would say, hey, we don't want you to be on a birth control pill when you're 60. So how do I know when it is that you're going through the change? Typically what we do for women is say, okay, let's pick an age together, patient-centered conversation. Let's pick an age that we're going to get off the birth control pill and see what you're doing. If I get a person off a birth control pill when they're 50 and they don't have any more periods anymore at all, and they don't feel bad, I just leave them off the pill. Hey, you must have went through the change. Your body is not producing enough estrogen. You're postmenopausal. Great. If I take them off their birth control pill when they're 50 and all of a sudden they start sweating all night and I want to kill everybody and all this and my joints and I'm brain fog. Ooh, sister, perimenopause. We're not through it. If they still have cycles and have these symptoms, they're perimenopause. If they do not cycle and still have these symptoms, they might be postmenopausal. So then I would probably get an FSH level to find out, are you really postmenopausal or are you perimenopausal? And either put them back on a birth control pill put them back on it for another year or two and be like, hey, girl, sorry about that. And put you back on it for another year or two and check again later. Or you're postmenopausal. So let's talk about hormone replacement therapy, which is the way lower dose of estrogen or progesterone.
Okay. So even though, just to be clear, yes, even though I have an IUD in, if my doctor thought it was a good idea to put me on a birth control pill, I can be on those.
I would do it.
Yeah, two at the same time.
Yes.
Okay. And
the universe made you get pregnant. If you want a birth control pill and an IUD, that's the universe, girl. Go buy a lotto ticket. I don't know what to tell you, but yeah, no, they're completely different. It's pretend like I put that IUD in your knee.
Got it. Okay.
It doesn't matter.
Okay. And then it will be covered. It can be covered by insurance because the reason is for, like, basically,
insurance is not going to know that you have this IUD and it doesn't matter.
Okay.
They will cover birth control. Now, if your doctor said, I don't want to do that, you already have progesterone. The reason why with the progesterone, if you're going to add estrogen, is to make it so that you don't get uterine cancer. Remember, we just talked about if you sprinkle too much estrogen into the lining of uterus, you can get cancer. So your doctor might be like, well, I just want to try you on estrogen only. Okay. That might be the reason to say that.
Right. And birth control is both.
But you typically got to pay extra for it. At least out here, like if I'm going to give somebody estrogen, their insurance does not cover it the same way they cover a birth control pill. So I personally would just do the birth control pill because it's cheaper and it's easier for me to regulate.
Going back to the question about cancer.
Okay.
So you're just blowing my mind because what I didn't realize is that birth control is way more amount of hormone than HRT.
Well, HRT generic. HRT means hormone replacement therapy. Anytime you're giving something hormones, you could call a birth control pill hormone replacement
right.
therapy.
Okay.
But hormone replacement therapy for a postmenopausal patient, those doses are much lower than a premenopausal patient.
So now I'm talking about the worldwide internet, which is fucked up. There's so much talk about how HRT and cancer intersect.
Okay.
But HRT, the way in society we're talking about it now, which is perimenopausal, postmenopausal.
Sure.
But yes, birth control is also adding hormone to your body so why isn't there talk around birth control?
Because you would have made it anyway. So what people are probably saying is the additional hormone beyond when your body would have normally made it.
Got it.
I don't want to take any hormones. I'm like, you are literally ovulating. You are making estrogen and progesterone every single day. You are 32 years old. I don't want to take any hormones. You make them every single day in your body.
Got it.
I just am going to give it to you in a different dose so that you don't get pregnant. But I'm not adding anything to your life that you don't already do. When you are 60, if I give you hormone replacement, your body was not making that. And so they may be talking about what your guest was saying. I'm stimulating tissues that should not be stimulated anymore at this age by me intrinsically. You're giving me something that my body would not have done.
Got it.
So those are two different spaces. So when people do talk, it is confusing, particularly if we don't have a really good understanding of what it is that we're saying, like I'm wrapping ropes around my ankles and that's what it sounds like.
When you would do aerial examples for me.
Oh yeah, my aerial example. Yeah, girl. I spun down, girl. You should have seen me twisting and twirling, looking like a candy cane, girl. You should have seen me. Mm-hmm. I wrapped that up. You can believe it. Looked like I was in a Dungeons and Dragons movie. Okay, anyway. So when people are talking, they generically sometimes don't recognize what they're saying. So then a doctor might say something generically out loud. A patient absorb that, go and repeat it to somebody else. And now we're all talking about spinning on some ropes. So those two, whether you're talking about premenopausal or postmenopausal, it's like apples and
it's night and day, like a totally different conversation.
Yes. To me, it is. For some people who are doing lab testing and want to get you, maybe it's not to them, but to me it is. And it's really important to talk about expectation,
Because I don't know this because I feel like the boomer generation never talked about this. I feel like Gen X, once we realized what was happening, that's why it's so loud, because it's Gen X that's like, what the fuck is this?
Yeah.
Because y'all never told me. My mom didn't tell me. Yeah. About her experience.
And they didn't know. And by the way, people my age weren't trained in this in residency either. Oh. So a lot of doctors are very uncomfortable having this conversation. And so people are like, you didn't bring it up. They're uncomfortable. We didn't get trained in this. Honestly, don't get me started on residency training is to take care of indigent population. It was the way that we did it for people who couldn't pay, right? So the government would subsidize hospitals to let people practice on other people, and people who let people practice on them a lot of times don't have money to go to private practice. And so most of those patients were cancer patients or pregnant patients, because everybody's getting pregnant, but older people who came in with complaints. If you don't have insurance coverage, you're probably not heading to the doctor about your hot flashes. You might have a little bit of a higher concern than maybe that, or you don't have the money to pay for an inconvenience in your life, right? So there's a lot of social reasons why people in that clinic population don't show up with these types of complaints, to give residents the opportunity to quote unquote practice on them.
Oh, that makes sense.
Yeah, so I would definitely say that a lot of us are uncomfortable, and I graduated right around the WHO study, right? Oh my God. Like I think the divorce rate probably went up by 80% when we just snatched everybody off their hormones around 2002 or 2000, whenever that study came out, right when I was graduating. So the fear around.
So back up. So that study basically said there's a link between HRT and cancer?
Yeah, basically. So like, hey, you can only give it if they have hot flashes that make it so they can't function in their life, or they have vaginal dryness. Those are the only two reasons you were allowed to give it, because their cardiovascular or stroke risk was too high. So that was the mantra in our...
Wait, vaginal dryness, because that affects men's ability to have sex with the women?
It affects women's, like that's hurt, painful, but you can give vaginal estrogen where you're not sending it through their whole system to give them increase their stroke risk. But really the mindset around that was for safety, but really we didn't do a good service to women, because the study was really crappy. I was going to say the SH word, and I'm trying not to, but the study was really crappily presented to the communities, because the average age for the women was like 60, and you didn't even take out the fact that half of them smoked. Like, we're not trying to start, somebody who's 50 who's just going through perimenopause, and the menopause is a completely different bird than somebody who's 60 who smokes. Like, her stroke risk is different, or breast cancer risk is different. So we didn't stratify that well and explain it well, which we're paying the price for now. And so we have definitely done a disservice to perimenopause and menopausal studies based on the fact that we thought we were going to cause harm. So I'm excited, actually. I won't be practicing in that space very much more, because I'm going to focus more on labor and delivery. But I'm excited that we now are at least recognizing the impact of us not acknowledging brain fog, and acknowledging joint pain, and acknowledging hot flashes, and acknowledging, mental health changes that happen during perimenopause, so that we can at least normalize the conversation and try to hold space for people. At the same time, however, giving them appropriate expectations, because if you're expecting to feel like you're 14 years old when you're 70, I would say that's an inappropriate expectation.
Okay. Now, because no one told me this, am I looking forward to being postmenopausal? Is it better than being perimenopausal? Like, is the worst part of this process before?
It depends. I have some people who don't have one hot flash. They wake up one day, never have a period again, and they feel amazing. It's great. They're like, hey, this is great. I have some people who suffer. My 70-year-old, if she misses her HRT dose, she will have a hot flash, and she works on a farm. She's like, I'm out in the field every day. I can't even move I bale hay. I feel great on my HRT. I cannot even get out of this bed without it. And so she's not amenable to her appropriate life that way. So it just depends on the person. A lot of it has to do with family history. If your mom floated through it, you might float through it. If your sisters before you are really miserable, you might be miserable through it. It just kind of depends. And I think it also depends on what it is you're looking forward to. What does your partnership look like? What do you want for your sex life? What do you want for your libido? What do you want for your activity level? If you're a person who was on a factory line doing hard labor for her, maybe you're looking forward to going down to Florida and laying out on a raft, and you never want to move your joints ever again. And that's great for you, versus somebody who was sedentary forever and now wants to start pickleball. You know what I mean? It just depends on what it is that you're looking for and looking to. I mean, it just depends on the person. I love it. I love every age that I have gotten older. I think my 40s has been the best for me, even though I probably hurt the worst body-wise and feel my age the worst. But mentally, I feel like this has been the best for me. And I think my 50s will be even better. Like, by the time you're 40, you're like, you know what? F it. I got this, and I know what I'm doing, and I know what I'll tolerate, what I won't tolerate. These different places that in journey that I've gotten to mentally has been my favorite in the 40s, even though I feel physically the worst.
You know what is so freeing? I don't know if I gave a fuck before, but I certainly
but you really
do not.
Don't know.
Yeah. Like, for example, I just started a new second job because I work around 10 to 15 hours at the aerial studio. And now that Bean is in full-time school, start a new job. I'm teaching Pilates 10 to 15 hours a week. And
Nice.
It's at this bougie gym called Lifetime.
Okay.
I don't know if you guys have Lifetime. I don't think so in Columbus. But anyways, it's bougie. It's like expensive to be a member. And then if you take any of the private sessions, it's way more expensive. It's expensive.
Oh, okay.
And tell me why I do not give a shit. It was Halloween yesterday, and I walked around that place in an inflatable starfish costume.
I'm so glad you did that. And we don't need to care what everybody else is thinking. You worry about yourself and what you're thinking. If it made you happy, then I'm happy for you.
I think I used to. I don't know if it was like embarrassment, but I just don't have it anymore. And you know what else I don't have? I don't have my libido is like way down to Dr. Janae. Yeah.
Oh, absolutely. There you go. Welcome, perimenopause. Thank you for that.
Okay, so I am having that symptom, but it doesn't affect me the way the brain fog did, because the brain fog really affects me in my daily life, whereas the libido, you tell me if this is my hormones changing, Dr. Janae. I do not give a fuck about love or sex. I just want peace. Is that my personality, or is that my hormones gone from my body?
Well, I think it's maybe a little bit of both. Yeah. You along with a whole lot of women in the country are going through a mental health journey that our moms did not do, right? There was this whole push for us to like find ourselves, set boundaries, eliminate codependency, all this stuff. That wasn't a thing. Nobody went to a therapist. Our mom's generation didn't do that. So there's a whole lot of mental stuff happening with our generation that frankly our moms didn't have the privilege to be able to do
Correct.
it. I think everyone deserves the opportunity to go to therapy. It's not that they didn't have the same problems that we have. As far as your sex drive, that's marked by a whole bunch of different stuff, right? So some of it has to do with estrogen. Some of it has to do with how we connect with our partner. Some of it has to do with how new or old our partnership is, right?
Yeah.
I bet you, God forbid something happened to your partner. I got people whose libido is like, I want it every minute. They're 55 years old. They were divorced 5 years ago. They found a new partner and they feel like they're 16 again. Well, that has to do with like where I'm at in connection with my partner sometimes. So there's a whole lot around that. But if it's not impacting the relationship, then I tell people it doesn't matter unless it's either impacting you or your relationship. The definition of sexual dysfunction only is within the partnership. So we don't have sexual dysfunction if I don't really want it that much and he's okay with us not. If there's no disconnect between the partnership, it's not considered dysfunctional. I have some patients who do not ever have sex. They're fine with that. There's nothing wrong with them. They're just more asexual than somebody who is really disappointed that they're not getting it every single day. So, yeah.
I think this would have been really convenient to have a little of this personality when I was 20-ish.
Yes, this would have been very convenient,
because
which is why I'm working with my kids.
I care too much. If somebody was in love with me or somebody wasn't in love with me, I would have like gotten the stress. It was so stressful before.
Yeah, very stressful. Yes.
And a lot of that is hormone, right? A lot.
A lot of it is not understanding boundaries. I wouldn't blame the hormones on we caring about whether somebody cares about me or not. I would say that we don't understand boundaries. And what we don't teach our children is that it's way more important about how you feel with a person than how you feel about a person. We can look at a person and be like, oh my God, they're so amazing. They're the smartest. They're the most athletic. They're the most romantic. They're the most creative. They're the most artistic. They're most all these things. And if you can think that about somebody, but if when you're with that person, they don't make you feel like they feel equally that way about you, you're confused. I'm not sure if they like me or not. I'm always seem like I'm the one reaching out first. I'm doing it. If you don't feel from them the way you feel about them, that's not a healthy space. That's not a space to be in. But we don't look at it like that. We work really hard to try to talk somebody into being in the same mental space that we are. That's not hormones. That's just leaky boundaries.
Oh, girl. Just called me out on my
your podcast.
My podcast.
Like F you, Janae. F you.
No, because I want I want to blame it.
I got 3 ex-husbands. I am not. No, this is me humbly stating after weekly therapy for 3 years. Thank you, Keita. Shout out to Keita, my therapist. Yeah, no, this is me. I'm the queen of leaky boundaries. That's the past couple years. I've worked on that really hard, and that's why I took a break from men. But yeah, this is something we need to societally teach us, but that's not a hormone thing. That's a society thing.
Girl, I was trying to blame our hormones my whole life and all my personality, my boundary problems.
Sorry, I love your personality. I'm not. No, I'll hold space for you wanting to find an excuse. I think you have a great personality. No, I can't acknowledge.
I mean, myself today. Oh my God, I love it. I wish I could have pulled this off a little earlier, but it's okay. We're here now.
Yeah, but you're a good example for all these women on the podcast, for your daughter. Like, it's fine. We are where we are. We work with what we got. That's what we got. You wouldn't be how you are now if you hadn't experienced the crap before. So,
you are
so you had to do it.
Absolutely right. The confidence now is like, I mean, youth is wasted on the young people. Dude.
Right.
You know what I'm saying? Right. Dr. Janae, I appreciate you. Listeners, what happened is last night around 9 something, I get a call.
I'm sorry.
No, I'm up. But I get a call from Dr. Janae, and I don't get a call from her very often, so I pick up the phone. And she's like, you know what? What are you doing tomorrow morning? And I'm like, I'm doing this with you. That's what's happening.
Yeah.
I'll grab you whenever I can get you.
Well, glad we got it.
I know.
Yeah.
All right, my listeners. Dr. Janae, the queen.
Thank you. Good luck, listeners.
Okay, and next time you and Kelly have a drink, you got to have one for me.
Picture. I definitely have no problem with that. No problem.
My listeners, if you would honor me with a 5-star rating and a review, I would appreciate it forever. It is the hardest thing about being a podcaster is to get your podcast out to the people who want to listen. So the best way to do that is to have a good star rating and just ride that algorithm. So I really appreciate if you guys would just open the Apple app and leave me a review. It makes such a difference. I appreciate you. I also have Greener Grass with Digitent Podcasts with my friend Kelly McVeigh. If you want to hear my voice twice a week, it's there for you. It's light, it's heartfelt, and we bring on some really amazing guests. All right, my friends, over and out. This is Carrie from Wrap Your Head Around Silks. This is The Expecting Aerialist.